Welcome to the Clinical Liver Disease video series. CLD is the digital online educational journal of the American Association for Study of Liver Diseases. Today I'm here with Dr. Lindsay Matthews, who is a chief medical resident at the University of Wisconsin, and Lindsay and I have co-authored a paper entitled Psychosocial Evaluation in Liver Transplantation for Patients with Alcohol-Related Liver Disease. Thank you for joining us today, Lindsay.
Thank you.
My first question to you is a general one. What were the main teaching points that you wanted to make in this paper?
So we wanted to highlight that psychosocial assessment is such a key component of the overall liver transplant evaluation, especially because there's scarce organs to allocate to so many potential recipients. And we know that alcohol use disorder is very complex and the length of sobriety can vary from individual to individual. And so this makes it extremely important to have a more holistic review of each candidate rather than just relying on a fixed period of abstinence, whether they be a candidate or not.
And why is a standardized approach to psychosocial assessment so important?
So a standardized approach can help assure ourselves as a transplant group, but also patients and their families, that every candidate is getting scrutinized in the same way. And so this can remove some of the subjectivity that so many committees have cited as being such a hard part of the transplant evaluation process.
What are the key elements to this standardized approach?
So there's been several different tools that have been validated to help with psychosocial assessment, and in general they have focused on the same domains, and that's insight and understanding of their underlying disease process, their social support and family support, any comorbid psychiatric illnesses and behavioral problems, and then also their substance use history, any alcohol use disorder, and any treatments they've received for that. And so it's a pretty multidisciplinary approach, and so we rely on expertise from addiction medicine and psychiatry and social work to help with this evaluation.
So hearing that, it makes me wonder, where does that leave the practitioner who is not in a transplant center? Should that person who has a patient with alcohol-related liver disease attempt to triage them from a psychosocial point of view, or should they refer them to a transplant center?
So at our transplant center, our psychosocial assessment takes about 45 minutes, and we have a lot of dedicated resources to help with this evaluation. And so no one question or one particular piece would automatically make a patient ineligible. So I think it would be worthwhile to give the patient the opportunity to undergo this full psychosocial assessment before making a decision one way or the other.
Thank you for that very interesting overview, Lindsay. And thank you for watching this edition of the CLD video series. I urge you to read the paper in the journal, and thank you for watching.